In this episode, we are going to talk about epidemiology and clinical medicine. Traditionally, clinical medicine focuses on individual patient who needs medical care, whereas epidemiology generally concentrates on the general population, including those with or without disease. Clinical medicine focuses on individual patients who needs medical care. Physicians provide personalized treatment to each patient, put most of the attention to the diagnosis and treatment of disease, and very rarely they would ask why and how the patient gets sick. While epidemiology generally concentrates on the general population, including those with or without disease, and the focus of epidemiology is prevention instead of treatment. Although there are major differences between clinical medicine and epidemiology, they are still closely related. Because the practice of medicine is dependent on population data, the process of diagnosis is population-based. The same holds for prognosis. For example, a patient asks his physician, "How long do I have to live, doctor?" And the doctor replies, 6 months to an year. So, on what basis does the physician prognosticate? The answer is on the basis of experience with large groups of patients who had the same disease, were observed at the same stage of disease, and received the same treatment. So when we try to solve clinical problems, such as prognosis of a disease, we conduct clinical epidemiologic studies. We raise researchable questions about disease prognosis and solve it in an epidemiologic way. Similarly, selection of appropriate therapy is also population-based. Randomized clinical trials that study the effects of a treatment in large groups of patients are the ideal means for identifying appropriate therapy. Thus, population-based concepts and data underlie the critical process of clinical practice, including diagnosis, prognostication, and selection of therapy. In modern epidemiology, the knowledge of epidemiology and biostatistics become very important and essential for the clinical investigators in the design, data collection, data analysis, and interpretation of the results. Next, we are going to introduce two important concepts in epidemiology of the clinical field. The first is clinical epidemiology, which is a branch of classical epidemiology. It's a joint discipline of clinical medicine and epidemiology, applying epidemiology principles and methods to solve clinical problems, such as etiology diagnosis, prognosis, treatment. This graph summarizes the differences and relation between clinical medicine and epidemiology, and applications of clinical epidemiology, such as to identify risk protective, prognosis factors, and to select the best option for clinical medicine. The second important concept is evidence-based medicine (EBM). With the development of clinical medicine, more and more scientists realize that medical care decisions should rely on using the most rigorous data available. EMB can improve healthcare by bridging the gap between research and clinical practice, allowing medical decisions to be based on the best available scientific evidence. Evidence-based medicine is the integration of best research evidence with clinical expertise and patient value to make clinical options. There are 5 steps in conducting evidence-based medicine, which starting with asking a clinical question, then acquire the best evidence and appraise the evidence, followed by apply the evidence, and last assess your performance after the application of evidence. This graph shows the pyramid of scientific evidence. Level 3 is from observational study, including expert opinion, individual report, case series, cohort study. Level 2 is from experiment studies, including randomized and non-randomized clinical trial. And the top level is from critical appraisal, including evidence-based practice guidelines, systematic review, meta-analysis. That's all. I finished all the introduction of epidemiology. Could you master all of them? Thank you, everyone.